Hey everyone, I'm Dr. Sebastian Gonzalez, and this is part 2 of our video series on how to manage low to mild grade muscle tears. And again, most athletes will consider these as strains. Recapping some of the highlights of the last video, let's just think about what a muscle tear actually is, especially a small one. Because most athletes seem to think that it's actually not a tear until they experience the inability to walk after, let's say, a quick movement or a misstep, or even that feeling of a pull or the tightness and pop that you feel. Those are usually associated with grade 2 tears, which are managed a little bit differently than a strain. So just realize that going forward, and actually those ones sometimes get bruises. So moving forward, I want you all to realize that if we are not on the same concept or same thought process with this whole video series is going to be for loss. Alright, so just understand that I know I'm beating a dead horse in this, but a strain is actually a grade 1 tear. Again, a strain is a grade 1 tear, and they heal in a similar fashion as grade 2 tears do. Now, last time we went through the first 5 days following the initial onset of injury, or what you guys might consider the point where you start feeling pain. And we went over the Price method, or rest, ice, heat, and compress, and etc., whether that's outdated or not. Now this time we're going to go through the current research surrounding what we call the mobilization period, and what we believe in our clinic that we have our people do. Whether your healthcare provider decides to use this method or not, it's up to them. But just realize that these methods might be a little bit different than what you would expect to use at the time, such as icing for months and weeks on, and actually might be hindering some of your progress. Now, to access that last video and educate yourself a little bit more, we do have a link up there to our YouTube feed, and you need to subscribe to that. If you do, you'll get that video and you understand what's going on in this one as well. The mobilization period, one thing that it's not is actually an aggressive stretching period. Aggressive stretching at this point we feel can set you back and actually is higher risk. According to our interpretation of the current research, we believe this period, or the mobilization period, to be within about 7 to 21 days. During this point in time is actually a great time to do what we call active motion stretching. And all that is if you can probably imagine this analogy, is imagine sitting in a chair and your hamstring has been torn or strained. If you contract your quad and straighten your leg out as far as you can without pushing it or having someone else push it, you can feel a stretch on it, and sometimes that's enough during this period of time. We feel the main reason for doing this is actually to accomplish a couple things. Number one, it'll actually mobilize the joint, so it'll decrease the amount of adhesions and sticking of the joint overall, but also too, it'll mobilize that new scar that's forming. Personally, I think that our athletes do not want to risk re-injury at this point, and for that reason we do not recommend aggressive stretching during this period of time for the athletes we manage. The mobilization period is also a great time to implement light tissue work or light massage. Again, lots of different types of massage out there. Again, the key and the idea is light. The reason why you want it light is because during this period of time there's that fibrous tissue or scar forming, which is important to have. But at the same time, you don't want to tear it apart by being too aggressive. The idea behind the massage or light tissue work is going to be to try to align that scar so it becomes more of a functional scar, they call it, over the long term, and you'll have less of a problem later. A great analogy, I think, anyways, is going to be brushing out dreadlocks. I mean, I would imagine if someone has a tendency of forming dreadlocks, or their hair gets all matted, if you brush it out every day, it's probably going to be way easier than waiting an entire year for that thing to happen and basically brush it out then. It's going to be really hard to do. So at this point, if you guys haven't actually subscribed to our feed as well, not our YouTube one, but actually our other one, which is where we put out our podcasts, articles. We try to interview different types of healthcare providers that would help us with these types of conditions as well. That's where all the good stuff is. And we obviously don't have as many videos on it because we got them all over here. So please subscribe to that. You guys won't be disappointed, and you'll see that we try not to repeat information. So if you subscribe today, you won't actually miss anything because we try not to repeat again. Some of you might be thinking, what about ultrasounds, E-stems, TENS units, and so on? These are known as passive modalities in our world, and yeah, you can use them at this point, or at least I don't see any problem with it. Do I use them? Not a lot. I mean, it's just not something I work into my treatment plan, but it's actually not a bad thing to use at this point either. So as long as we're working towards a common goal of actually decreasing the scar tissue formation at this point, you're going to be better off than if you were just resting or icing, because scar tissue is actually shown to be of an inferior quality, more so than the stuff that's already there, according to at least Watkins in 1999, and it supposedly has a higher risk of re-injury, according to Williams, I think in 2001. So scar tissue is kind of the big culprit here. You just have to know how to manage it. So now I know all the athletes out there want to know how they can stop the scar tissue from forming. But the reality of it is you can't, really. I mean, it just happens. And each athlete who's had a strain or tear or worked out very hard has scar tissue that's formed. You just have to make sure it forms well. High quality or low quality, what do you want? So the last analogy I'll leave you with is going to be, just imagine there's a pothole in some concrete, and you bring some extra concrete and you just throw it in there and you don't smooth it and you leave. Alright, it's going to harden into something that's just all messed up, haphazard, there's really no care to it, it's not smooth. So we want to make sure that yours is smooth. And with the providers out there, healthcare providers, what I'm talking about is we want to decrease cross fiber adhesions as well as increase the amount of relative slide to adjacent structures. That's our main goal with that. So the next video is going to be on something we call the early strength period. And this is going to be from about 21 days to 6 weeks, which I personally think is one of the most important phases and one of the least managed phases of these types of conditions. So next time, or actually subscribe to our feed, and I'll tell you why I think it's one of the most mismanaged periods of these types of conditions, and we'll go from there. Thanks, guys, and remember, this video is not intended to be something for medical advice at all. I'm educating you guys. Take this to your providers, your healthcare providers, and show them that you understand your injury, and they'll give you much better care from that. Take care. See you next time.